statement was drafted by the lead researchers from the three main studies, and also from Swiss statement, the author Swiss statement. But what we needed at that time was a public official, someone with a major voice in the U.S. and also on a global scale that would sign on and that was unaffiliated with the studies. And so I went to actually quite a few different places and had the door closed in my face. And a lot of people said, we agree with the science, but we don't want to say that because for various reasons, people with HIV will stop using condoms. They won't understand what it means that you have to be adherent in order to stay undetectable and untransmittable. So I'm very proud to say that I'm a New Yorker. Because Demetre and New York City Department of Health, within, I guess it was about 2 weeks after we sat down, and Demetre didn't hesitate. He said, absolutely, the data doesn't lie. And within 2 or 3 weeks, he had City Hall signed on, and it was the first major endorsement of this message, which is negligible risk at the time, which is still consistent with U equals U. And then right after that, NASTAD came on without hesitation. We were thrilled about that as the first NGO, and Housing Works as the first AIDS service organization. But it was still a battle in many cases at that point. Even though we had these major acres behind it, we did a lot of fighting, and now we're doing a lot more educating. So at that time, we were really lucky. Also, Terence Higgins Trust in England and AID in France had national campaigns that were already launched, but there was really nothing else in the world at that time. So we say the campaign was really born in New York City, and then it grew up in Canada. When Katie signed on, it went global. Right after that, we had sort of IAS and IPASO and AIDS Map all came on, and it really started to grow very, very quickly. There's some organizations around the world. Really, these organizations you see here are the innovators. They came on early, even before the CDC, even before UNAIDS endorsed the message. So these are all the organizations that I just feel and actually there's many more. This is only a fraction of them. One really exciting thing is we have cities and states coming on. So as I mentioned, we had New York City signed on first very early on, and Washington, D.C. became the second city in the country. They had a campaign that I'll show you in a little bit. Chicago also signed on. City of Chicago is the third. New York State Department of Health, first state in the country, signed on recently, as well as Michigan and Minnesota. And then citywide programs like End the Epidemic 2020 in New York, Getting to Zero San Francisco, Paris, and the City of London. Paris signed on this summer. City of London is saying U equals U. So now we have 440 organizations, 64 countries, 15 languages. It's absolutely fascinating. And I'm just going to show you the love here, show you some of the ways that the organizations are speaking about are changing the definition of what it means to live with HIV. So this was New York City back in December, billboards of Times Square, this gorgeous campaign. This is Washington, D.C.'s U equals U campaign this summer. This is the city of Paris. This is City of London, Do It London. They use Undetectables on infectious and link to our site. These are the world leaders. Terence Higgins Trust had the first campaign in the world a little over a year ago. And the French also came on the aid very early on. They launched a campaign, a 70-city campaign, the black and white one. And then the one on the left is their summer campaign, their Pride campaign. Aid is the largest AIDS charity in Europe. This is New York City. Housing Works, awesome campaign. Planned Parenthood came on. The British HIV Association, ACT UP Dublin has been very engaged. Mount Sinai Institute of Advanced Medicine. I think this is interesting. They're using this in their testing campaigns to start to destigmatize HIV. This is in Spanish, I equals I, N equals N, in Dutch, U equals U, in Turkish, H equals H, in Macedonian. This is the only gay health clinic in Guatemala. This is the French campaign that was the Italian campaign just launched yesterday here at the European AIDS Conference. Very beautiful U equals U campaign. On the left is the Russian campaign that just launched. On the right is the Czech campaign. another Netherlands, and then a major pharmaceutical company is endorsing it as well. So this, I think, is cool. And we're seeing individuals all over the world actually creating their own kinds of messages. And I thought this was cool because Victor from the US created a similar campaign to William in Uganda, in very similar messaging. It's just kind of cool. And then we'll see on the left is Belfast, I t-shirts. We're in Madrid. On the right is our friends in Kampala. On the bottom is Lyon. Bottom left is England, and in the middle is England. On the top left is New York City. Top right is Manchester, England. And bottom right is Montreal. Bottom left is Chicago. So you can see people are rising up all over the world. These are just a smidge of examples. But one thing we really need to be mindful of going forward is the third U, unequal. There are many, many economic, social, structural, legal barriers that make it impossible or difficult for people to reach and maintain an undetectable viral load. So we really need to use the U equals U public health argument to demand access to treatment care, viral load testing to leave no one behind. We just formed a partnership with International Treatment Preparedness Coalition Global to work on this very thing. And we have a section on our website called The Third U with lots of resources on this. We also, in addressing communities and educating about U equals U, need to also be mindful of communities and understand who will be most effective to engage people that have a long-standing history of being neglected by the healthcare system and have competing priorities where food insecurity, housing, poverty are the top priority. So everyone needs to know this information. It doesn't mean the information should be gatekeeped and blocked from them. It means it just needs to be shared in the right way by the right messengers in a sensitive way that's, the way that's sensitive to the realities of their experiences. And criminalization is very important to look at how this unintendedly criminalize folks that have a detectable viral load by writing into law that if you're undetectable, the laws aren't subject to you, but because you didn't put anyone at risk, but detectable folks would be subject to the law. So that's another thing to keep in mindful about, as well as the stigmatizing language around detectability. Now, just before, if there's anything I'd like you to take away, is when you talk about this, please be absolutely clear, because we're talking about the risk from a human being. When you talk about the risk from a human being, you need to be impeccable. Don't leave wiggle room for risk, because many of us living with HIV and folks who carry fear and trauma from the plague days and those who wish to harm us will find a window to confirm that we're dangerous. They will find ways to confirm their preconceived notions of people living with HIV. And this is not about, we're not talking about the efficacy of PrEP or how likely you are to get into a car accident or fall into a sinkhole. This is the risk from a human being. So here's some examples of what we've seen work and not work with our partners. This is on our website, so it's probably easier to just go through it then for the interest of time to look at it at some point. But just be clear, there's language that will convey there's still a risk, and language that will convey there's no risk and will reduce stigma. And when you're thinking about messaging, the main thing to think about is it's actually not that hard. It's not that complicated. It's about adherence. The medicine works if you take it. So to stay undetectable, take your medication every day. This is about sex. This is not about needle sharing or breastfeeding. This is just one option in the prevention toolbox, which also includes condoms, which prevent STIs and PrEP in some parts of the world. And the focus is keeping us healthy, we're not prevention tools, so keep an eye on your messaging around that. Also be aware of judgmental messaging about people's level of viral load or their choice whether or not to start treatment, and sexuality and sexual practice. So just before we leave, this may be going through your mind, because it still goes through my mind, is that you may be still feeling some internal resistance, and that's the cognitive dissonance, because for so many years we're trying to unlearn 35 years of fear of people living with HIV and fear of HIV that we've been taught. And so try not to let your subjective feelings and experiences guide you here. And we usually say, trust your gut, but maybe not in this case. Maybe trust the expert. And I mean, I even feel insecure. at times about this, and I do this every day from morning until I sleep. And so one thing I would say is borrow confidence from the experts. Just borrow confidence. Think of what the experts are saying, because I'm not an expert, and most people on this call are probably not experts in transmission risks. So we'd love you to join us. I mean, people living with HIV, as you saw around the world and with our allies, we're changing what it means to live with HIV in so many exciting environments. Our website has lots of resources for you to join and learn about the science and all aspects that we talked about earlier. You can sign up as a community partner. There's the 5 agreements online for signing up. But most importantly, say it. Please tell somebody, and say it in your own way, but say it accurately, and make sure you tell people, because people still don't know, and everyone deserves to know. So you can really be a part of history making if you join us and you share the news in a way that works for you. Thank you very much.
Thank you very much.